Hey guys, welcome back to Chad Knows. I'm happy you joined us today. So I'm Dr. Chad Peters. You guys are at the Rehab to Go channel. What we're here to talk about today is the number one thing that everybody comes to the doctors for. It's low back pain. And I don't care if you're talking chiropractors, physical therapists, going to the ER, talking to your Uncle Sam who happens to be a nurse at one of the hospitals. It doesn't matter. Low back pain is the number one reason for doctor's visits pretty much for the last 20 years. So let's talk about the most common condition. So I know this is Rehab to Go. I'm supposed to be showing you tips and tricks. I'm supposed to be up and moving around and cutting the fat out of stuff. But on this particular one, it's not about the rehab you give them. It's about how you talk to the patient. You have to treat this thing the right way or they will never get better. Why am I known as the guy that doesn't like stretching? Why am I known as the guy that doesn't like rehab? Because when you do it in the wrong order, people are not going to get better. And if there's anything you're going to learn, if there's only one thing that you're going to listen to me and never watch me again, this is the video to get it. Because this is the one thing that has changed my career and my clinic more than any other thing I do. It's not even my most common thing, but it's the biggest impact I have on my patients, and it's the biggest thing I've been asked to lecture about. So let's get to this. Who is this video for? Is it for you as the clinicians? Is it for you as the patient? I don't know my audience. I don't know who's watching this, so let me just lay the scenario out there and you can figure out on which side of the coin you are. But let's say you've got your guy, like we all see him. He can barely get out of the car. You see him coming from the parking lot away and he can't move. And he's walking like a Civil War vet and can hardly go. He's got the limp like a zombie movie. He walks in, doesn't want to fill out his paperwork. He is in anguish, so much pain. You know he's got a low back problem. He doesn't want to sit in your waiting room. So we finally get him in the back. Does it sound like you? I mean, we've all had this before. The Red Cross estimates that 90% of the population on planet Earth will have low back pain at some time in their life. And I'm telling you, I think it's more than that. Everyone gets this. So let's quit making it a big deal and let's treat this as a normal condition that happens. That's the first thing I tell my clients. I've seen this before. I know I can help you. I know you're in a lot of pain, but we have to teach you what is going on or you're going to do the wrong thing. Like I said, Rehab to Go is about cutting the fat out of the whole project. So the first thing I'll tell you is how to do our diagnostic tests. When I do my lectures, I like to break it down into 5 categories. The first thing I want people to have is how does this issue present? Well, I've already talked about the presentation. The poor guy can hardly move. The next one is there any orthopedic test that we can give you that will help us make our best diagnostic decision? And on this one, there is a couple. So as a doctor, as a clinician, you still have to do all your orthopedic tests, but there's a couple that should stand out. These are the clues in how you want to proceed. The first one is, does it hurt to change positions? Now this guy won't take a seat in your waiting room. It hurts him to change positions. And just ask him, hey man, is it hard to get up and down, especially getting out of bed in the morning? You're always going to get the, oh man, I can hardly move in the morning. I move like an old man. After a minute or two, I kind of start to loosen up and I can move around. That's very typical of a disc strain or a disc torsion. Now, depending on your profession and depending on where you got educated, it might be called an annular fiber strain. It might be called a disc herniation. Hopefully, we're all done and dead with the slipped disc term. I mean, guys, a slipped disc, if you're still using this term, you have to quit. A slipped disc is for our little plastic skeletons that we all have as doctors. And I can show you as a patient, hey, see your little disc here, this little plastic piece that slips, and you know that's not how the anatomy works. Let's get better at our explanation. Use one of these terms. I tend to use disc torsion or disc strain. If you're working for professional athletes, I was always told never say the word disc because you don't want some guy walking out there and thinking he's got this old lady issue like his grandma sitting on a porch somewhere. Oh, my disc is acting up. It's getting cloudy outside. My next test, have them take a deep breath in. Does that cause any pain? It shouldn't. When we take a deep breath test, we're looking for rib stuff, and I'm going to talk about that on one of my future videos. If they take a deep breath in and hold their breath and squeeze, that's a true Valsalva. You might say things like you learned from your professor in school, like you're trying to hold in a sneeze, or like you're trying to blow up a balloon that won't blow up. Just show the poor guy how to do it. Breathe in, hold your breath, bear down. If he doesn't anguish and it hurts, it's probably this disc strain that we're talking about. All right, one of the next ones that I use, and it fails to make sense to people. I lecture all the time that we need to be better detectives as doctors and clinicians. Well, this is one that you're getting a clue on a plate. If you don't use the clue, then it's your own bad. Ask them, have you tried ibuprofen or naproxen? Almost always they will tell you, yes, they've tried one of those or one of a couple other anti-inflammatories. Did it seem to help or take the edge off? Because if an anti-inflammatory takes the edge off, and you combine that with a positive Valsalva, and you combine that with the poor guy not being able to change positions, guess what? He's inflamed, right? Now the body's reaction to inflammation is different depending on the body part. If you sprain your ankle basically swells up and sends you a huge signal, a huge clue, hey, we're not supposed to move this a lot. But in the spine, it's different. You've got all kinds of nerves that go to everywhere, and they go to important things like organs. So your body doesn't want to swell with the potential of causing nerve irritation. So what happens is the body locks all the muscles down tight. And that's where all of us, me and you, and their well-meaning friends, and their wives, and their massage therapists, and their clinicians, it's where we all blow it. A tight muscle on palpation, like using your hands, is very easy to recognize. This poor guy came in and told you he's got tight, spasmed up muscles. Of course you can diagnose that. But the problem is the tight muscle is not the issue. The issue is at the disc. You've already established that. So if the guy's taking an anti-inflammatory and it takes the edge off, and yet you're using treatments that are pro-inflammatory, such as heat, a hot shower, stretches, rehab exercises, massage, sit in a hot tub. All of those things are the opposite of what we're trying to do. This poor guy is at stage 1. He is on fire. And we're giving him stage 3, rehab, exercises, loosen up tight muscles. It's ridiculous. The biggest thing that will fix this guy is you explaining to them that they are inflamed. They already know it. They basically told you they are, but yet some doctor somewhere has told them to start these stretches or roll over or get a massage, all of which doesn't work. I typically try to make them laugh as a patient. They're in a lot of agony, and I'll say, hey, have you tried the hot shower yet? Oh yeah, man, I jump in that hot shower and I can get it really loosened up. I sit in there for 10 minutes, I'm nice and loose, I'm ready to go. Oh yeah, how about after you dry off? 10 minutes later, can you put on your socks? Yeah, impossible. You have just re-inflamed an issue. Now in the sports world, the terminology that they like to use is on threat. So if your lower back is on threat, the body's response is to send the alarms up and lock that thing down. We're not worried about the locking mechanism. We're worried about reducing the threat. Switch this guy over to ice, and it's good to go. You get better a lot faster. Now, as a chiropractor, I still like doing moves. I still like getting in there and moving the joints, taking the pressure off the disc. But this is not a chiropractic alignment issue. It's not a chiropractic mobility issue, nor is it a weak muscle issue. At this point, it's just stage 1. Alarm bells are going off. So start to change that. If you want to see information more on how I handle this, or the actual handout sheet I hand every one of my patients, you can just get on my drchadpeters.com website, and where I've got the PDF, and it will give you the exact handout I give my patients. Why do I give them a handout? Because when they are in severe pain, they do not want to listen to me talk about how smart I am. What they want is someone to do some work and get them feeling better. So I typically get them inflamed, get the inflammation down. I go in there, I give them a handout and say, hey man, here's what's going to help you. My treatment protocol works like this. Come on in, I'm friendly, we go through all the exam and explanation and evaluation like any good clinician should. And then I put them on electric stim and an ice pack. I want them deflamed and desensitized well before I start doing any of the work. Now as a chiropractor, I want to do some adjustments, but not because the pelvis is off or the lumbar is off or any of the typical chiropractic crap. What I want is to decrease the stress on the disc. And then more than anything, I want them to understand what to do at home. This is Rehab to Go. Do not use heat. That is your first lesson on my first Rehab to Go. Get the heat out of there. These disc strains or hot discs or on threat lower backs, they tend to resolve in about 3 visits over the course of a week. Now the other thing that's interesting about these, and anyone that's ever had one before, and all of you have had this before, is you understand it. When you sprain your ankle tends to get better in steps. Every day is just a little bit better than the one before, and that's why rehab is so valuable for a sprained ankle. But in the spine, stuff doesn't work like that, especially in these hot discs. In the hot discs, it goes through like a sound wave type of deal. And anyone that's ever had this before, any of you experiencing it right now, you get this. You feel it. You have this 10 hours of feeling pretty good. Man, that Dr. Peters, he knows his stuff. I'm feeling better. And then you're going to have 10 hours of getting wailed on again because it all came right back down. As a young doctor, I was so proud of myself when someone would get up off the table and say, hey, doc, you're a miracle worker. I feel so much better. Now, that's not the case. I tell them, hey, I appreciate that, but this thing always takes about a week to get better. This is it, guys. You'll hear it all the time. I don't care what you call it. Know how to treat it. When they're inflamed, that's the way you handle it. I'm Dr. Chad Peters. I'm going to have more Rehab to Go stuff on the way. Stay with us.